The Ebola outbreak in the Democratic Republic of the Congo is showing signs of further escalation, with health officials warning that the spread may be far wider than reported. Rising infections, deaths in displacement camps, and growing concerns over surveillance gaps are complicated response efforts.
The number of confirmed Ebola cases in the Democratic Republic of the Congo has risen to 676, including 136 deaths. Health authorities warned of continued community transmission and the risk of a sudden geographic expansion of the outbreak. The Ebola outbreak, declared on May 15th, has affected 29 health zones in Ituri, North Kivu, and South Kivu. Health authorities warn that rising weekly Ebola cases point to ongoing community transmission and the risk of the outbreak spreading to new areas. More than 5,700 contacts are being monitored, but weak contact tracing remains a challenge. Meanwhile, two patients recovered in Bunia, bringing total recoveries to 32. The outbreak declared on May 15 is the DRC's 17th Ebola outbreak and is complicated by displacement and cross border movement in the affected regions. The United Nations Refugee Agency said in a report published on Thursday that two Ebola related deaths have been confirmed in a displacement camp in eastern Congo. The two victims were internally displaced people living in the Kapangba camp, which hosts 30,000 refugees. The agency further added that the high risk of transmission required strengthened prevention and response measures. Coming to the protest against a planned Ebola quarantine facility at Kenya's Laikipia Air Base near Nanyuki, a 17-year-old student was killed during demonstrations opposing the US backed center for Americans exposed to Ebola. Police said he was struck by a tear gas canister, while witnesses claimed he was shot. The proposed 50-bed facility has sparked public anger, with protesters accusing the US of shifting Ebola related risk to Kenya. At least two other people have reportedly died in the unrest. World Health Organization expert warned that the Ebola outbreak in the DR Congo may be more widespread than official figures suggest due to surveillance, blind spots, and high risk areas. Authorities recently reported the disease spreading to three new health zones, while a shortage of isolation beds and the lack of an approved treatment or vaccine for the Bundibugyo strain are hampering response efforts. Shivani's report for DD India.